I'm Dr. Peg Strub, Chief of Allergy at Kaiser Permanente, San Francisco, and I'm an Assistant Clinical Professor at the University of California at San Francisco. We're now going to demonstrate how to use a nebulizer. This is the nebulizer machine that is available by prescription. We also use tubing which does need to be cleaned on a regular basis. But we're starting with a new set of tubing, which we're going to open up the sac. And we're going to go ahead and take out the chamber. And we're going to take our medication and put it directly into the chamber. We're now assembling the T-piece, and we're going to assemble the mouthpiece. I'll call you back in 2 seconds. We're now going to assemble the tubing, which has a connection on the nebulizer machine as well as the tubing. We're going to make sure everything is tight, and oftentimes we'll check that the mouthpiece is comfortably situated to go directly into the patient's mouth so that it's straight. And then all we do is go ahead and turn the nebulizer on. And we're going to put it directly in our mouth and then take slow, deep breaths. Slow, deep breaths. And then every couple of breaths, we really try to hold it down. The biggest problem with the nebulizers is that sometimes patients will be trying to inhale it too rapidly. So we always want to slow the patients down and take just slow, deep breaths. I'm Dr. Peg Strub, Chief of Allergy, Asthma, and Immunology at Kaiser Permanente, San Francisco, and I'm Assistant Clinical Professor at the University of California, San Francisco.